Last night and this morning, we ran a story that has gotten a lot of people talking. A local chiropractor who does baby adjustments on newborns. And when you see the video, you'll understand why a lot of people necessarily don't understand it. They have questions about it. So we brought in Dr. Franca Alterman, chiropractor at Alterman & Johnson, to talk about you got this passion to work with babies and your practice just really has exploded. Show us first what you do very quickly. And then I want to pose a couple questions to you while you're doing it.
Okay, very good. Well, when I have an adult patient, I can ask them to stand in front of me and I can look at their posture and see if their head is tilted or if their shoulders are off. But with a baby, how would you do that?
Right.
Well, the easiest way is to hang them upside down, just like that.
Okay.
Now, it doesn't take a lot of time. You just watch them for 30 seconds or so, and then you bring them down.
Let me interrupt you quickly just to ask you, because some people are concerned. They say holding a baby upside down, is that safe? The baby's muscles, everything is still growing. They're worried about the blood flow. Why do you think that this is a safe way to do that?
I think if you were to hold the baby for 2 hours, that wouldn't be safe. But if it's just an overview for 15 or 30 seconds, it's not a big deal. I use that in conjunction with looking at them this way and looking at them this way, and then asking the mom if they notice that the baby's head is always rotated to one side or tilted to one side. So it's just one of the ways that I can examine a baby.
This is your activator,
yes.
and we kind of tried this, and it's not painful at all. What does this do to help align the spine?
Well, as you know, the bones of the spine can actually misalign like this or like that. So by placing this soft rubber tip right on the bone and then clicking on it, it's almost like you have a little hammer and you're just moving things over. It's one of the most gentle ways to make an adjustment. And so we use this on babies. We can apply it on the neck or on the hip. We use it for pregnant moms.
Right, and we'll talk a little bit about that. A few more questions for you after the break, and we'll talk about how you first got started working with pregnant women. So stick around. We'll be right back after a short break. We're back with Dr. Alterman, a Jacksonville Beach chiropractor. And Dr. Alterman, you adjust newborn babies, some as young as a month old. We talked with a local doctor who said that this isn't harmful, but his feelings were that there's no benefit to this and it's a waste of time and money. And then also some questions from parents who say, is this too young to be working on a baby? What do you respond? How do you respond to those?
Well, I think that most of the negative comments come from people who really don't have any information. Once you understand how the spine works and how misalignments of the spine can really affect your health, why would you want to be a month or 2 months into it instead of right away? So the youngest that I adjust a baby is as soon as they're born. I did that with my own daughter, and that's what I encourage my patients to do, to bring their babies as soon as possible. This one little baby who had really bad breastfeeding issues because his head was tilted like this, to the point that his ear was folded over.
You talked to that mom, too.
Why would I ask that mom to wait a month, 2 months, or 3 months to try to get this corrected? In fact, we started working with that baby 5 weeks old, and we got great results, and she was able to breastfeed him, which otherwise she would have ended up bottle feeding him, which is not what she wanted to do.
Yeah, and while a lot of people refute what you do, there's a lot of moms who say that they have seen the difference. Let's talk about the moms, because that's really how you got started.
That's right.
I learned about you at my natural birthing class. I was intrigued by it and wanted to learn more. You said that you can work with pregnant women to help their babies turn if they're breech, and you can also help them with pain, because obviously it's a lot of weight load on your back when you're pregnant.
That's right. In one of the slides that I sent you, I don't know if they can show, but let me show you right here. If you turn sideways, there's a natural curvature in the lower back right here that goes forward. And as you begin to gain weight here because of the baby, it exaggerates that curve. So if you have any previous misalignments in the lower back or in the pelvis, that exaggeration of the curvature is just going to make all of that come to the surface. That's why pregnant women have so much lower back pain.
Okay, and then you work with them.
We realign everything
during that process.
Yes.
Okay, Dr. Alterman, thank you so much for coming in. You're at the beaches. If people have more questions, they can look you up, and you're very passionate about what you do, so appreciate you sharing with us.
Thank you for having me.
All right, time check, 8:47.